transportation of these populations that we're talking about. We have all these people working together. We've been able to create service standards, act as hired staff to work on these coordination efforts. Started to collect a lot of data to gain a better understanding of the need. I think that was one of the most challenging parts of beginning this, is that, again, we didn't start with any data. We're still trying to refine the data, get better data so that these questions like you had, Ken, are answered a little bit better. And we have a better idea of where we need to focus the effort. We've established a lead agency to run the coordination efforts through, which is COAST. Secured a number of different types of funding over the past 5 years, including the funding we mentioned before, the 5310, purchase of service and capital purchases, where demand response providers have been able to purchase new buses. We've expanded routes with the North Bus as an example. There's more, I think more routes have been expanded also. I know that the Farmington route is out there now, and it's doing a little bit different. I guess it's a little bit different than it used to be. All right. And so, yeah, this chapter goes through some of these, primary accomplishments over the last 4 years. And I think, again, significant steps have been taken. We're in a much better position to start implementing a lot of these coordination efforts than we were 4 or 5 years ago, which is exciting. And I think this year we're establishing the call center, the software. I think Brad was just working out the contract with HBSS, the software company, and really starting to get ready to implement the service, start purchasing or coordinating between agencies to help be a little more efficient at picking up those in need of a ride, and other groups like that. Goals moving forward.
Can I ask you a question?
Yep.
A lot of the elderly facilities, like nursing homes and what have you, have their own transportation.
Mm-hmm.
The hospital now they all have their own vans and stuff like that. Does that fit into this at all?
A lot of those other transportation providers, they do fit into this. They've been actively participating in a lot of the TAC meetings. They've been there developing the strategy all along, and it's been really helpful. We have a really committed group together. The hospitals have been really tough to work with. It's hard to get them to call back. I think they're really busy a lot of the time. And I don't know if, initially I think there was quite a bit of hesitation because they didn't know what was going to happen with the coordination effort, and they didn't want to get involved in something that they didn't have guarantees about. But going forward, I guess the goal is to really have more participation from more agencies. I think if we can show that this effort works on the ground, then they may be more interested in participating in the future. So we'll see what happens, but that's one of the goals, is to really expand membership and get more people to buy into the system, because it'll work better the more people that bought into the system. I think transporting people is an expensive thing to do, but it works a lot better if you're doing it efficiently.
Right.
So,
if I can just add one little piece to that. In terms of, I have a little bit of information about sort of what happened in our area. We've got 2 hospitals, and one of them started providing transportation services as a good thing to do, but also really use it heavily as a marketing tool, which drove the other hospital to say, we can't have them taking away our patients, so we need to do the same thing. And in both cases, they were completely funded, not using any sort of public funds. So to the extent that there might be leverage from somebody who is granting funds to a variety of entities who can say, rather than us giving you dollars to buy a van and you dollars to buy a van and you dollars to buy a van, and most of these vans are sitting still most of the time, get together or you're not going to get any money at all. There's a strong incentive now to work together. It may not be as convenient as it would have been for each one to have their own, but it's a whole lot less expensive. But when things are done through private fundraising. There's not that incentive to bring them into the fold. And so the conversations that I had, at least in terms of encouraging that sort of a relationship, I think were trumped by the marketing piece.
One question occurs to me, as being one of the older people here, one of the traumatic dates that faces me and everyone else in the future is your driver's license. And when they cancel that, I got 2 more years. And then, again, you go have a mortgage exam. I talked to a lot of older people, and that's one of the things they're really fearing, is when they lose that driver's license, your whole lifestyle is going to change. If you're in Rollinsford, and well, you could say, well, your wife can drive, but I'm older than her, but I'm afraid she's going to lose hers before I do. But if both of us lost it, we're really grounded, and we don't have any idea as old people. Then suddenly you get that letter saying you've been denied or whatever. What are we going to do? And where do I turn to find out these things? And how many of these people over 80, let's say, are getting denied when they ask to get it? Once they deny that, does that word then go out to other agencies? Or, is Coast going to be able to come by my house? You don't go by now. And what? If the thing you get in the hospital, well, I don't really worry about getting in the hospital. I'll call up the ambulance service, 911, and we'll get down to the hospital, the 4 miles. That's a hell of an expensive way, perhaps, to do it, but other alternatives. But I'm not going to worry about that really until that crisis occurs. But we really ought to be thinking about helping this older population, because we're going to have a lot of them losing their driver's license in the next 10 years that didn't before. I don't know what proportion that really creates a crisis for us, but somebody ought to be correlating denial of licenses and with the other agencies, and how I cope. Or well, the simple thing is to move out of Rollinsford and get an apartment down in Dover or somewhere where I'm near coast or whatever. And so in the big cities, that's not actually a problem, but in the small towns, if you lose your driver's license, it triggers all kinds of problems.
It's an issue.
We're going to get you a boat yet so you can row over to South Carolina.
Yeah, but to get down to the river, I got to walk a quarter of a mile, and after I'm 85, I'm not going to be able to maybe get down a quarter of a mile. I'm being facetious, but I'm just saying that again, there are a lot of problems that are going to be triggered, the function of this demographic transition.
And in some ways, that's Glenn was talking earlier about thinking about land use in conjunction with transportation, because they're so interconnected, but we also need to be thinking about land use and residential opportunities and the changing demographic. So to the extent that we've seen over the years, people want their own big piece of property, way out the sort of suburbanization. But as the population ages, that becomes more and more of a problem if they're relying on a single occupancy vehicle. And unless the communities start talking about ways in which you can adaptively reuse space right in the downtown area, so that a lot of the services that you may need are within walking distance. Now, at some point in time, even that becomes an issue. But at that point in time, maybe the assisted living or the nursing home becomes the issue.
Right.
But at least we need to be thinking about, because if we don't allow, if from a planning perspective, we're not allowing land uses that recognize this increasing demographic and make it, then we're basically building in costs to ourselves, because if the demand of this cohort, which is going to be fairly sizable, says now we want bus service wherever we are, that's very expensive. It's just, it becomes prohibitive. Whereas if from a land use standpoint, we say let's provide more housing opportunities in areas along transit routes already and closer to the services that we need, that's a lot less expensive. But we need, so that's part of, from a planning standpoint, I think that's where we need to bring the land use issue. Again, it ties into our changing demographic the same way as it ties into transportation, and the same way it ties into our impact on the environment. There's, all this stuff is so interconnected, we just need to be thoughtful about it.
And it's also a cultural change. People want to live on their 2 acres in the middle of the woods. It's a culture change to move more into a denser population with services available.
I think the census is showing that's already happening, though. The culture
Yeah.
change has already happened.
It's
between,
happening, yeah.
2000 and 2010, if you read a lot of the development statistics and real estate statistics, it's already happened.
And that's, I guess, going further down in the chapter, we get into short-term recommendations and long-term recommendations, and some of these recommendations are, establishment of a call center, so that if you're an elderly person and you need to find out about how you can get around, you have somewhere to call and actually get that information and gain an understanding of, what is out there, what services are provided. We have volunteer driver training coming up in the next, I guess, probably the next year for some of the people for the coordination efforts. Implementing the coordination software, maintaining the group that's together now to do some of this planning work that we've been doing to get these services in place. And yeah, it goes through some of the strategies that are, currently front and center for the group in this chapter. And again, I recommend that, this is on the internet, on our website. Really recommend that folks get in there, take a look, especially at the strategies for the future, because I think that that's one place that communities have a big voice, need to have a big voice, talking about what do you need, what do you think is going to work, because that's really going to help shape the effort that goes into the coordination. And financially, there are some limitations that we have right now. It'd be really great if New Hampshire had the money to support transit a little bit more in the state. I think that'd be one really helpful step. But a lot of these strategies are the strategies we have come up with, and paratransit providers in the region have come up with. But it's also really important to hear from the community. So I really encourage folks to get into these chapters, take a look, and if you have any ideas about how to improve things, write a comment, send it down, come to the policy meeting next month. We're going to do a public hearing on this document. Submit comments so that we can, at least hash them out between the people who are making this plan and try to figure out what the best strategies are moving forward.
The strategy for my concern when I lose my driver's license at 87 years of age, or whatever it is I still want to keep the car and so forth. I want this call center where I can call someone up, and tomorrow morning I want to go somewhere, and you drive my car and so forth. I just want a driver, and I'll pay him and so forth.
They'll be 85 probably, and they'll be a volunteer. There'll be an 85-year-old volunteer probably.
Right, that
That's
still
what New
got it
Hampshire can
and
afford.
so forth, yeah. And so you can really solve my problem for me if I had fortunate enough to be able to keep a car and have a good sized car. I don't want, I want to ride my limit, my nice car. I don't really have a nice one, but maybe I will by that time. But anyhow, you see, that would be a pretty cost-effective way from my point of view. We don't have to coast a bunch of buses and so forth. I just need a driver that's certified to do that.
And that's what this is all about, is to create this kind of, I hate to use this term, one-stop shop, where you can call in as a member of the general public, and we will put our fingers out to see who's available to provide the trip that you're looking for, whether that be through a public transit service, whether that be a human service provider, a private for-profit entity who's willing to do trips, or through volunteers who are willing to provide that level of service. So, and the more that we can amass these entities together to work this way, ultimately the lower we drive down the cost of providing a trip for a general purpose in the region. So, and the greater availability we have to provide those trips. It's maximizing the efficient use of public resources first, and then also trying to bring in the private sector to help fill those gaps.
Yeah, I guess if there's any questions or you'd like more information about the coordination plan as it is, we're in the public comment period. Feel free to call me, email me. come into the office, sit down with me, and we can talk about the plan, where it's at, what's changing in it. It's also available on the internet, or we can print it out in the office for people who would like a hard copy of it to read over. So, next month, yeah, we're hoping to approve it once again next month. Just giving everybody a heads up about that.
Okay,
All right.
any more questions for Mark on this topic? Now, the annual listing of obligated projects for 11.
All right, this is another document that's mandated by the federal government to report the federal funding that's been spent on transportation in our region over the last year. And the period, I believe, is October 1st, 2010 through September 30th, 2011. So this plan really hasn't changed a lot from the format it's been in the last few years. Once again, the primary function of this document is to communicate to communities where the funding is going, the federal funding is going, and how it's being spent in communities. So going through, there's a glossary of information about the different, I guess, terms and yeah, just giving definitions about what we're talking about in the plan here. Talk about a little background for the Strafford Metropolitan Planning Organization, the communities we represent, and then going through giving some information about our plans, our public involvement process, and then really getting into the actual report of expenditures. So getting down here, we have the coast information at the top of our list, talking about the different projects Coast has received federal funding for. And then further down, we have all the projects in our region that have received or with obligated funding in fiscal year 2011. You'll notice that some of the numbers are in red. That indicates that the funding has been de-obligated, and that's basically the funding hasn't been spent, the project's been finished, there's funding left over, and then a number of other reasons which are outlined in the memo and also in the document for why the funding is shown as a negative. It's either it's being paid back in some way to the federal government, or it wasn't used, so it needs to go back. That's the general idea behind the de-obligation of funding. And so, yeah, this is, I guess, the list of projects. At the end of the list, we also have a big map. It's way too big for this page here. But it basically, Dan made this great map that shows our region, which is here, and where projects are happening. It's obviously a little bit too small to see here. We have some big printouts. Kyle's got one next to him that we can pass around. But it just gives an idea of where projects are happening in the region. It really doesn't get into many of the statewide projects. It's really just focused on those regional projects that have received funding in the past fiscal year. Something we worked on this year.
Mark, before you move on from that,
Yeah.
in terms of the listing, when statewide projects are listed, is that only statewide projects where something has happened in our county, or is that just statewide?
That's statewide, and one of the reasons is it's really tough to break out what's happened in our region, and we don't get lists from DOT that are broken out to be regionally specific. So those are across the state. A lot of the categories have funding in our region, you know, like guardrail replacement, bridge painting, all these programs that are really run by the state. They have their programs and maintenance, I guess, schedules, and that's how a lot of that funding is broken down and determined.
I mean, I guess my concern is, to the extent that this is supposed to be a listing of obligated projects, and if I wanted to know how much federal funds or local funds have been invested in my area, there's no way of, or even in the state of New Hampshire, I mean, every single regional planning area is going to have those statewide things. I mean, it seems like a report that might have had a good intent, but has really limited usefulness.
That's, yeah, I agree with that statement, actually.
Well, and for Coast, for example, these are a list of obligated projects. Well, we certainly don't take that to mean we spent $16.891 million last year. These are open grants. Some of these grants have been open for many years.
Right.
Most of that money has already been spent down, but that's not what we get asked. We get asked, what are your obligated projects as evidenced by grants? Here's the grant, here's how much money was applied for, etc. But no detail on what was spent in 2011.
Yeah.
So,
And that's one of the challenges of this document, and actually, this year I worked on putting together a list here, and actually it's full screen view. I apologize here, some issues getting the page layout in a way that makes things easy. This is terrible, I'm sorry. We have this list, and the list is also, I printed out copies for everybody. This is a list of the last 4 years of the annual listing obligations put into a composite document. I put this together to get a better idea of, where the money is actually going. Some of these data points, they are subjective, so this is certainly not set in stone. A lot of these intersection projects or transit projects were not necessarily classified as intersection or transit, but tried to group them into categories to give a general idea of where the funding was going, for what uses. I went through by community and put all of their funding together for each of the years. This button here, and it actually expands out on the years that shows by year which communities are getting funding, obligation, de-obligation. I think the most important thing in this this table here is really the percentage of the total funding over that period, which gives you an idea of, a much better idea of over time, where's the funding being spent. And I will say Dover is a little bit skewed. They had an earmark for Spalding Turnpike improvements for $18 million. So that's, a really big chunk of funding right there that kind of throws this off. But at the same time, I think it does a pretty good job of giving an idea of where the funding is going within the region. Yep.
So we've done these maps over the years, and I think they're really important to, basically the goal here is to show people by mode, if you will, or where the investments are going. So just a few critiques of this table, because I think it's a great draft to be worked into something, but I think there's some problem with the totaling down at the bottom for regional. We got a lot of zeros there where there shouldn't be.
Oh, these were, I'm sorry, let me clarify. These were district projects.
Oh, regional projects.
Yeah,
okay, I got it.
I didn't have a great way to put that in there, and also transit projects that were hard to split up between.
But I think what's important for, again, this message is in our planning region, what is the total?
Yep.
Oh, it's not on the printed, it's on your sheet.
No, it's on here. I didn't know if I'd have enough room to put it on there and have it still be visible.
Yep.
But this area down here at the bottom just kind of tabulates over the 4-year period where the funding is being spent. And so you can see maintenance and preservation and bridges are the two big things in our region. That's about 80% of the total funding.
So just a critique on that, and I want to just demonstrate something because it gets to what we've been talking about today about data, and this gets put out to the public, and pick up on one thing. So I'm going to just use Durham, which I can speak to as a detail. So Durham, in this 4-year period, shows 1.178 million of bike pedestrian. Now, I know what that is. That's the Main Street projects, which was a complete streetscape rebuild with transit, pullouts, adding bike lanes. But I'm gonna be facetious now. I'm gonna play a role. They spent 1.2 million on bike stuff in Durham. Ridiculous. But it was a street reconstruction. So I noticed you have a note in one of your things, and it's probably from the federal rules, that when a project shares funding across multiple modes, a best case effort should be made to assign the money across modes. So my case here is, yes, we spent $1.2 million redesigning a street to accommodate bikes, peds, but it was a street reconstruction project. So if someone had critically asked me what percentage really went to bike pedestrian, it is not 1.2 million, it's 10% of my, I don't know. But my point is, all this stuff, when we put it out under a public lens, needs to really be explained.
And actually, I did not include this in the annual listing. I just had done this for our own exercise.
Yeah, no, I understand. But I'm just, and I love this, and I think we should always do these things for each tip and look at them historically, because it really does, like your point about Dover is an anomaly, they got an earmark, but it's not an anomaly. This is a snapshot. It's meant to tell a story of what money we invested in the transportation system for real. I mean, it was invested. So I think to keep massaging this a little bit with these caveat notes, because it's really important for people to know, and in the end you'd get to which I think is on the screen but not on this, here's the amount of money, and we need to be clear, total, federal, state, that was invested in our region in the transportation system. People need to know that.
And
because it just gets lost in all the fuzz out there. But I really encourage you to keep massaging this, cleaning it up, pulling it together, because it is very important that we tell this story, and I would love to see it done in a way that is replicated methodology-wise with every tip, so that this Planning Commission MPO could say, here's the 08-11 tip, here's the 10, and tell the story over many years of the investment, or I would suggest disinvestment, across different modes in our region. And then the other thing that we know has historically come up, and it fluctuates all over the map, but it's good for us to know, is what our region's getting compared to other parts of the state. Where I'm going to get on my soapbox here about the I-93 corridor and the elephant in the, I don't say room anymore, the elephant in the universe. But that's important to be able to have that data to tell that story. So I would really encourage you to keep massaging this, working on it, with that caveat of explaining, some of these projects, we've got to come up with a methodology to assign the costs, because this is like the classic one where, someone will get up and say, Federal Highway spent $10 million building a bridge for frogs in Idaho, when in fact it was a highway bridge that just happened to also accommodate frogs crossing the road. So we don't want to play into that bad storyline.
Absolutely. This doesn't include any of the turnpike funding we received in the region. So, this Rochester funding probably, would be much higher.
I think it should. I think it should.
And I would add, I agree wholeheartedly, and this works really good as a searchable database. This works good electronically, not so much on paper. So it should always have a link to point you to where you can go to the electronic searchable database on the Planning Commission's website, and you should be able to drill down to the community, you should be able to drill down to every project in that community and descriptions of those projects, so that you can do exactly what you're saying.
I think that.
And I don't know.
Can I just talk to that just a little bit, because I agree entirely. As a matter of fact, I wish today we'd ended up spending the big report here that you have to produce for the feds. I wish we'd spent 1 minute on that. If you just simply said, this is the report we have to produce, there's very little useful information here, but we produced it, there it is. and then we spend time on this.
Mhm.
What's challenging, though, is to the extent that a lot of the funding for the Regional Planning Commission comes from entities that pay us to do the reports
Yeah.
that are useless, and that don't pay us to do the reports that are useful, that
To
how
learn
much
about
time
this.
we can sort of scooch on over to getting this useful information is limited by the constraints that we have. So I guess what I would encourage as well is, to the extent that you can provide documents like this that really are useful, that have information that is real and that is helpful, that's wonderful. But we also understand that in terms of how we get paid and how we get reimbursed, that we're within some pretty strict guidelines in terms of, we produce this report, we get reimbursed for the time we spend on it, we produce that report, even though this is the good one, and we get nothing because it's not something that's required,
Yeah.
so.
But one of the goals with this was to start getting some ideas together, how to actually make the annual listing
Yep.
mean something, because